The problem that's to be addressed should be defined by the folks themselves, people in the community in the first instance, and as are the solutions. And the reason for that is because they're actually the experts in the setting. And that's an expertise that they bring to the equation, right? So they're at the beginning and the end of the process. And even after the researchers leave the game. The folks that are living in this setting should be involved in the data collection in a way that results in a transfer of practical skills. So the process of doing, in this case, PPM or whatever kind of method might be used, ought to result in some leaving behind of skills that they may not have had before. Okay, now in our case, maybe that means that some kids can work with maps that they didn't. But we think that's an important thing. If you're going to go in and work with the community, that should be part of the package. There's a sense of reciprocity, right, that you really want to, because whenever we go in and work with the community, we're always getting something out of it implicitly, right? And we want to make sure that there's a good full exchange in that partnership. Now, of course, there's a role for the researcher, and it's, not surprisingly based on their skill and method. Okay, so what they're bringing to it, whereas community members have expertise in their own world, their own lived experience, their own setting, the research, what do we bring? Well, we bring skills and certain kinds of methods, and that could be qualitative, quantitative, mapping, photography, whatever. So we can bring that, and probably more importantly is that a method that we might have skill in is maybe is thinking analytically in some senses, right? Theoretically, we might look at things and say, oh, maybe this didn't occur to people in the community, we point it out, right? And that's also a contribution that we can make. So there is a role here for the researcher, and I think the key is to find how to balance their role with ours. Okay, in a way that works well in both directions, and that in itself can be a real challenge. The history of PPM, I mentioned that it started out of a particular community, and to a large extent there was a lot of luck involved in this. I had been approached by members of the South Madison community who were an economically marginal, predominantly African American community in a Wisconsin city. Okay. And to be African American in a northern state like Wisconsin, which is a very white state, is to be, in a sense, to really underscore your minority status even more than it might in some other states. So, and there's often African Americans actually feel quite a sense of isolation in those kinds of cities. So this community was struggling with a number of issues in addition to their economic status, their racial status, and those had to do with the fact that this community was probably the primary place for selling drugs in town. It's the primary place to buy them, primary place to sell them. And now I want to be careful here. That isn't because the residents were doing that. Some of them might have been, but it was the place to go to if you wanted to sell drugs. You'd get in a car and you'd go to South Madison, and if you want to buy them, you'd probably do the same thing. So that's kind of it. It offered an environment for some reason that was a good place to do that relative to other places in Madison. And the community had a sense of that, and one of the questions that came up for them during a workshop they had asked me to come and facilitate was, what's going on here? Why is that? Why us? And it's a complex question with probably some complex answers. But one of the things that they suspected is it may have to do with the layout of the place, right? So it's not surprising, we know this, that if you go to a fairly well-fleeced neighborhood, there's lots of wide streets, they're open, there's parks, it's very pleasant, lots of lighting, this sort of thing. They probably never have to call City Hall to get a pothole fixed, that kind of thing, right? So it works well. And in this kind of community, though, unfortunately, is also too common, is that those things aren't done, and there may not be as much thought given to the layout of the place. So typically here you might find streets that were dark. There might be only one or two access points to the neighborhood from the outside. not a lot of kind of interesting twists and turns with parks and this sort of thing. So in a lot of ways, it actually is a very good place to sell drugs, right? Because you can go in there, you can see who's coming from a fair distance away, you know, if you can see a cop car coming, that sort of thing. So it's, and also you're dealing in a neighborhood potentially where a population that is justifiably probably not entirely trustful of police. So the likelihood of calling the police is probably somewhat less if you see somebody doing something suspicious outside. So, all this makes a good place for people that want to do not so good activities to go in this case. So anyway, the community had identified for themselves that there's something spatial maybe going on here. There's something about the layout of the place. And they also had a pretty strong sense about the nature of what was available in terms of food outlets and also the nature of green space. Not just the availability of it, but who could use it and when, and that kind of thing, and the safety of it. So they had a strong sense of that. They also had a strong sense that, and this is adults in the room, different ages, different members of the community, and the strong sense that, you know, whatever we do, we got to involve the kids. We got to find a way of engaging the youth, if only for its own sake, right? Youth engagement. So we kind of left it at that. That was sort of the end of the workshop. They were trying to identify kind of where they might go and some things they could do, and that's kind of where they got in the discussion. They said, well, you know, more stuff with kids. It would be interesting to try to better understand some of this space stuff, spatial layout things. And it got left at that. And then coincidentally, about a month later, this funding opportunity came from the Robert Wood Johnson Foundation that said, if you come up with some innovative ways to, if you think you can come up with some innovative ways to work with communities around health issues, we'll give you some money to develop it. Okay, so the chair of family medicine approached us and said, would you work on that? So we did, we got some funding, and one of the things that helped us do that is we had a community we could work with. And so what we did is try to take what the community had suggested, those things like spatial aspects, youth, and try to put that together with something that would fit into this funding, and we'll see what we could do with that. And the idea of mapping came up because, well, as soon as you start talking about spatial layouts, maps are the metaphor, if nothing else, that comes to mind. And those might be fun things for youth to work with, too. So we kind of started with this kernel of the idea, and we started scanning around the campus for ending up finding Suzanne in one place and Rich in another place and Sam in another place and pulling them together. And then starting to work with the community around this to figure out what can we do with the skills they have to find a way that the community can document and communicate its lived experience, its situation. Okay? And so it could, if nothing else, take it a bit further in its thinking about what they might do, and also in its interactions with, say, public health officials, county officials, insofar as they influence what goes on in that place, including the police, actually. So over time, we were lucky everybody was able to work together quite well, and not that there weren't issues, but it was a real place where a new method kind of bubbled up. And at the end of the day, we found that we had developed something that seemed to have traction with the community, and it seemed to produce something interesting from a research point of view. And we figured, well, we should give this a name, and the name we ended up calling it was Participatory Photo Mapping. Okay? And we ended up publishing a paper on that. I'll give you the reference at the end. And but we figured we should at least try to distill this and capture our thinking about it, bearing in mind we realized we probably hadn't completely figured it out yet either. It was still a work in progress. That was in '05. We still think it's a work in progress. So, and talking to you is actually part of that, to get kind of your sense of things and your applications. And the more we talk to people, the better the more we're able to think about it and use it